Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, letting the guest process their thoughts, in addition to someone repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today I have Isabella Schneider with me to discuss the balance between surgery, physical therapy, and working out with cerebral palsy. Isabella Schneider is a 25-year-old who has cerebral palsy and epilepsy. She is an established writer and editor, having been involved with many publications from a news organization, magazines, and an academic journal. Isabella enjoys reading, watching television, swimming, in addition to being a CrossFit athlete and member of Word Weavers. Welcome, Isabella.
Hi, I'm so glad that you're having me on today. Um, I guess I will go ahead and kind of introduce myself. So I do have cerebral palsy. It is the spastic cerebral palsy, and it does affect all of my body, but the right side is probably, I would consider, the more affected side. Um, but my normal level of function, I do not require any mobility aids. And I would say that I'm pretty independent and I will reach out for help if I need it. But yeah, and then I also have epilepsy, and I had my first seizure when I was 23, and it was under weird circumstances. Just because it really came out of nowhere, but it was an absent seizure, and um, all of the kind of symptoms of it were um, involved memory loss and staring into space and things like that. So, but since then I haven't had any episodes, but I do have everything under control with medication for that. And yeah, I'm excited to go more into depth about my fitness journey and everything in that realm.
I am Kayla Ireland. I have spastic quadriplegia, cerebral palsy, and epilepsy. Cerebral palsy affects all my motor skills, so I need physical help doing everything. I am a power wheelchair user. However, I can take some independent steps and small transfers, like from my bed to wheelchair or from my wheelchair to the couch. I use an adaptive joystick to operate my laptop. In addition to having to be fed, I have a swallowing disorder. My mealtimes are complicated because I have to take small bites and sips, make sure that food is on my teeth and not stuck on the roof of my mouth. What were the red flags your parents noticed?
So the biggest red flag that my parents noticed were when I was born, there was a concern that the doctor said that I would um, have cerebral palsy and that I would have many um, developmental delays, and that my mental capacity wouldn't go past the mentality of a 5-year-old. Um, but physically, they certainly noticed that my legs and feet were turned inwards, like
Mm.
um, it looked really twisty and weird. um, but because there's a picture I have of that, and it's really interesting to look back at that and just wonder how I stood up and all that stuff. But so there was the physical delays, and then I think that was mainly it. So my parents were ready to kind of take on the challenges and start to get to the bottom of it and figure out how to improve my mobility so that moving forward I would be able to do a lot of things on my own.
My birth was scary. I exited the womb and into the world as an unconscious, full-term baby.
Wow.
The pediatrician performed CPR to give me my first breath of air. And as
Yeah.
that was not traumatic enough for my parents, an emergency transfer was initiated to another hospital better suited for my needs. I spent 12 days there in the NICU before my parents could finally bring me home.
Yeah, that's
Obviously, I
scary.
missed milestones too. I was diagnosed with CP before my first birthday.
Wow, yeah, that's really scary. I was born 10 weeks early. Um, and I think when I was born, like I couldn't breathe very well. And I also spent time in the NICU. I think I spent the first month of my life in the NICU. Um, and from what my mom has told me, um, they had to put like a heart monitor on and make sure everything was well when I was allowed to first go home. Um, and yeah, I mean, I was in the NICU, but I think I was one of the more fortunate babies in the NICU um, because I think a lot of the other children were, um, very sick or were just having a lot of trouble. So I'm very fortunate in that way. And but yeah, it's a scary experience to have all that happen, and um I'm just thankful my parents, were very supportive and just rooting for me to, you know, get better and come home with them.
Yeah.
Other than physical therapy, what therapies helped you as a child?
So when I was younger, I also did, besides PT, I did occupational therapy and speech therapy, as well as, I think it's, if I'm correct in saying it's called hippotherapy or equine therapy, yeah. And so I did all of those when I was very young. I think I did speech therapy for a very short period because it was very clear when I started that I actually didn't need it as much as people had thought. When I was like really young, I was very soft spoken, but as soon as I was like by myself, I was talking very normally and a lot louder. So, but yeah, occupational therapy helped a lot. And doing the therapy with horses was a very helpful endeavor and involved a lot of like stretching and grabbing things. And from a very young age, I really enjoyed horses and everything about it. So, my young self was like, yeah, let's go do this. So I had a fun time with that. And the therapist for that as well was very, very good at what she did.
Throughout the years, I have participated in top soccer and therapeutic riding in addition to aquatic, physical, occupational, speech and feeding therapy. When I started riding, I needed the help of a leader and two side walkers, one of which was an occupational therapist assisting me with my poor head neck control and weak core strength. After 13 years, I transitioned to the elite discipline of paradressage.
Oh,
It is when the horse and rider perform a test in a 20-meter by 60-meter arena that is ridden from memory and follows a prescribed pattern of movements. Besides giving me the therapeutic benefits of riding, this challenges me to learn dressage vocabulary, patterns, and autonomy as I control an equine on my own, off lead.
yes, that's awesome. I did equine therapy, I think um for a couple years, and then I remember specifically when I was like 9 years old and we had moved to a new area, and I was really wanting to do riding again. And so I picked up riding at a local um horsemanship place near me, and I was able to do that um off lead without any aids and stuff. And yeah, it definitely helps with like working on core strength and balance, and learning how to um, work with your partner, being the horse. And so I've done a lot of like flat work and working on the ground with stuff so that can translate well to riding. And I've done a couple of schooling shows, so nothing like too big or anything. But I did do horseback riding lessons for um many, many years until I was about 18. And then I went to college, and then it kind of tapered off a little bit. Um, but I did like the place I rode at had a horse park down the street from the barn.
Mm.
And so we would go do the obstacle course and stuff like that. And that was always a lot of fun. And there was like a little meadow area that we could like canter in and everything. So that was a lot of fun. Um, and then, we did some cool stuff during the summertime. So if it like where I live here, it can rain a lot in the summer. And there'd be like these giant puddles that you could just walk through.
Mm.
And then sometimes we'd put sprinklers out and go through that. And so it's a lot of fun. I really enjoyed it.
Riding reduces my high muscle tone and improves my balance, posture, gait, and stability. Horseback riding stretches my muscles and reduces my spasticity. This allows my movements to be softer, quieter, and more accurate. As the
Yes, yeah.
moves, I am constantly thrown off balance, requiring my muscles to contract and relax in an attempt to rebalance. Riding requires me to coordinate numerous muscle groups to work together to get the horse to start, stop, turn, and bend in the direction we are traveling. And the horse provides constant feedback for me to react to, which in turn improves my motor planning. Stopping and starting the horse, changing speed and changing direction engage my core muscles. Increased core muscle strength directly impacts posture, head and trunk stability, which allows me to be as independent as possible. All these benefits help me physically and emotionally get through the day and week and reduce the constant tug of war I have with my own body. This makes participating in daily activities exponentially easier for me.
Yeah, I totally agree with all of those benefits. I definitely noticed um as I got older, like the more stuff that I did during a lesson or whatever the scenario, maybe the more um that like I would be sore at the end, but it would like
Mm.
help stretch my legs out and everything more. Um So yeah, I love the benefits of writing. It's so helpful.
Ugh.
Did you try oral medication and or injections before surgery?
So I don't think I did any kind of oral medication or injections before my parents um did or had me do surgery. Um, but I did do Botox injections after I got an select dorsal rhizotomy, which is like a back procedure that goes into the nerves directly and cuts some of them to help reduce spasticity. Um, but I only did Botox injections, I think, in my calves for a little bit, but they didn't um, prove beneficial to continue. Um, but besides anything else, I didn't do any kind of medication before surgery was considered. I think it was just with the way that my deformities uh appeared, that's surgery was the only kind of step that we could do.
Please talk about your surgeries during early childhood.
Yeah, so um and no, like, I guess, I mean, I do have my list of surgeries next to me. So my first one was actually the select dorsal rhizotomy, which is pretty major to do. I think I was like 4, something like that. And that's a pretty major surgery, opening your back up like that, and it's
Mm.
um and there's definitely there was concern that you're at risk for paralysis if something wasn't done correctly. Um, but that did prove to be beneficial in reducing some spasticity. And then I think that the year after that, I had my legs and feet like literally straightened out. Um, so like they just since everything was rotated in, they had to do some tendon transfer stuff and um literally like turn um my femurs and my feet to a neutral position. And so I have a lot of plates and screws and my femurs, and they did some lengthening. Um and yeah, so they got my that was kind of, those two big things were the basis of just how I was able to then get around so much easier um, as I went on. And then I'm sure we'll talk about my later surgeries because after that last one, I didn't have any other surgeries as a child. So, but I mean, nonetheless, those were really big and scary and required a lot of recovery time.
What was your experience having physical therapy in elementary school?
So, in elementary school, the school I attended offered a physical therapy program, and as a young child, I had like a developmental assessment done. So when I started school there, um, they put me in a physical like education class, but it was specifically for people with disabilities, and um, that was that proved to not be something that challenged me enough, um, to the point where like my mom had to come in and advocate for me through a lot of conferences and stuff to get me put into a regular PE class. Um, because when I was that young, I was the only kid in that class that didn't need any additional assistance, or, and I was someone that actually helped start activities, if things stopped for a second. And then the other thing was that I did have physical therapy in elementary school, and that was kind of what I got transitioned to instead. So I had PE, but then I had one-on-one physical therapy, and they would pull me out of class at a certain time of the day, and and I would do PT for however long. I don't remember specifically how many times a week I would do that. But it worked, some OT stuff in there, and got my stretching in, all those types of things, and tried to help improve strengthening and mobility. So in hindsight, was it the best? I don't know. Because the knowledge of in that time period was very different from what it is now on cerebral palsy and the approach to treatment, but it was that was the physical therapy I had in elementary school. And then I think it was like when I was like 10, um, I was like in fourth grade, and I remember being in a meeting with the therapist and my teachers and stuff, and I basically got discharged from PT because I had good grades. Um, don't I don't understand, to this day why that would really correlate to how how that reflects on my physical well-being. But um, you know, that was the decision at the time. So I did PT through majority of elementary school. Um, and then after that, as a kid, I was like, okay, well, I guess I don't have to do that.
Believe for me in
Yeah.
elementary school.
I'll repeat that.
Twice a week, I believe for me in elementary school.
Um, one more time, I'm sorry.
Twice a week, I believe for me.
Um, so
I don't remember specifics, so I think it was good. My overall experience in public school was supportive.
mm-hmm. Yeah, and it was interesting for me because at one point, like when I was in PE and I was doing like the presidential, like the fitness test stuff, and one of the physical therapists, I think, actually became a gym coach. And so she got to kind of see more of like what I was able to do. And and the interesting thing too is like um it, I, my mom was told me that like she was told that they were really concerned about putting me in regular PE because of falling and getting hurt or something like that, even though most kids are at the same kind of risk in PE, like anybody could have that happen. So um but um the person I had, she was decent. And she had me do a lot of stuff. She wanted to really teach me how to walk properly, but I think there was a lot of things that she didn't totally understand why my body compensated the way it did. Um, but towards the end of that point in treatment, was when she kind of figured out specific um, machines and equipment that were beneficial, like a treadmill, being able to help, focus on the steps and controlling how fast I went, that type of thing. Um, but yeah, it was an interesting experience, but
I
um,
always had a paraprofessional with me throughout the day who was familiar with me.
mm,
I'm sure my therapists gave their input as needed.
mhm. Yeah, I did. I also had OT at one point that would come and I think one of the concerns was like I was writing too slow. And so I had I don't know if you're familiar with the device called an Alpha Smart,
No.
but it's the way that I think of it is like it's like a predictive text thing like on phones and stuff. And so basically it would predict what I was writing and then you could like connect it to the computer and you could print out your assignment or whatever you typed up. And so she would come and help me with that. And then I think at one point they said I was okay with writing and everything. So I actually have that device here. I'd have to like find new batteries or something, but it's a cool device. And I think it's funny how that translated to everyone's phones and things like that to get um information and text out faster.
Did you feel left out or different?
Honestly, I don't think I ever really did. I knew that like my mobility was different, but I didn't let that stop me from enjoying everything that classes had to offer. Um like still did my absolute hardest at um my PE class and I participated in in all
Mm,
the group projects. I made a lot of friends.
yeah.
Like with on in elementary and high school, or yeah, I would say all of school really. There would be a point where I know so many people. I would just like walk down the halls and everybody saying hi. So I definitely felt included, which was great. And if I had a problem, I would go to my teacher and be like, "Hey, I need extra time on this," or "I need extra time to get to classes," things like that. So I did have a 504 plan and an IEP, um, so that I had those options as needed. But yeah, I felt very included, and I made sure I got involved in activities at school. So
I
yeah,
don't remember feeling different as a kid, but the yearbook doesn't pay attention to if every member is in at least one picture of each extracurricular activity we are involved in.
mm,
My picture didn't make the drama club or track pages in the yearbook.
oh no.
Did you always know when you needed to modify things in gym?
So when I started to like do stuff in the gym was probably more in like when I started high school, my freshman year, when I took a weightlifting class. And I think at the time I didn't always know when I need to modify something, but I definitely tried my best to do it without any modification. But um there was times where it was like, okay, like everybody starts somewhere. And if I have to start it out in a modified way, that's completely fine. Um and yeah, so I didn't always know that I needed to have it modified, but as I started to kind of educate myself on fitness and things within the gym, you learn very quickly that it's okay to have them modified.
Yeah.
Um and it everybody will do it at some point. It's not exclusive to just me or it everybody will do it at some point.
Mm.
I used a gait trainer in addition to both a manual and power wheelchair. How was the weightlifting class you took as a freshman in high school?
It was interesting, because I was, like, one of 3 girls, and the rest of the people in the class were all guys. Um, but I think we had one teacher that, like, had us do a workout every week, and, I made sure I did everything, and, like, if we went to the track or something, um, we could run or walk, so I basically walked most of that time, and, I had a good time. I tried to make sure I could go and try out every machine possible, um, and if I needed some help putting some weights on, a barbell or something, I would reach out to somebody and do that, and, and then we had, another teacher at one point during class, and he kind of let us do our own thing, so I was probably one of the few people that actually did stuff, throughout the entire class,
Mm.
because that's what I chose it for. I was like, "Might as" yeah, I needed an elective, and I was like, "Might as well make it a fitness related thing," and I remember when I chose that class too, that there were some people that were like, you sure? Like, are you sure you could do that class?" And I was like, "Yeah, I can." Um, and so, I proved a lot of people wrong, when I took that class. I mean, there was one time where I actually fell and people were concerned and all that stuff. And
Mm.
I just like scraped my knee or something. And I was like, I just need a band-aid. Like I literally just was like, can I just get a band-aid? That's it. Um, but yes, I mean, so sometimes, I'm gonna fall, but it's gonna happen.
In high school, I attended 2 practices a week and participated in the stretching as much as I could, then walked laps in my walker.
Mm.
I ran the 100-meter at home games.
Oh, wow.
Even though I competed against myself, my family, coaches, teammates, and spectators cheered me on. My first track meet was in the pouring rain. We
Oh,
had
wow.
to take a hair dryer to my wheelchair afterwards.
Wow. Yeah, I think there was at one point where I wanted to join a track team, but I think I didn't know how to do that, per se. And then, um, I think physically at the time, I think like I had to be realistic about it and was like, I have to find another activity that I can do modified. Um, but the, that's amazing, especially like with the first meet being in the rain. Oh man.
Did you participate in any sports as a child?
I mainly participated in horseback riding. So after I did equine therapy, I basically just like begged my parents to do horseback riding, and I was like, "Can I do any kind of horseback riding?" Um, and that was kind of my main um sport growing up. And the barn that I went to really made sure to just focus on um doing a lot of horse sense related things, um, working on the ground and translating that to your writing. Um, and I did, like I said, I did do a couple of shows, but shows weren't kind of the focus, if that makes sense.
Mm.
Um, but if we did do shows, it would be like schooling shows. And we did have the opportunity to like do a little bit of jumping here and there. Um, but yeah, I rode a couple of different horses and they definitely all had their particular behaviors, and some were really good at, um, teaching. And but I had a blast, and it was just so helpful too when we were able to do an obstacle course, whether it was in the arena or down at the horse park. And we had plenty of trails to go out and ride on. And yes, that was my main sport. I did that a lot, and if there was a week that I wasn't riding, I would try to go and volunteer and get free riding out of it.
Mhm.
So I would clean stalls and all that stuff. I would help clean tag, um, and then I would get free riding.
Did you have any surgeries in middle and high school?
I am fortunate. I did not have any surgeries during that time. Um, I mainly focused on doing school because um, at least for where I went to school, for both of those specific times, I had a lot more stuff on my plate, because I
No.
I joined bands. I played French horn, and so I was in concert band, and I attended practice, um, pretty often, and, I I think also around that time is when I started to walk home from school, and that was by my own choice because both middle school and high school are right around the corner from where I live, so, um, at one point, I was like, "I can just walk home from school and just get started on my stuff." Um, but yeah, I was really lucky to not have to worry about any surgery, during that time, so I just mainly focused on, academics.
Higher grades are busy.
Yeah. Yeah, they are, and I was that person that took I took honors classes, and I took AP classes. Yeah, yeah, and so I was busy, man. I had a lot of stuff to do, and between that and doing band and, um, I had my plate full. And, like, all the different organizations I joined, I was pretty busy.
You started walking home from school in middle school. Did you
Mhm.
realize how important fitness was then?
At first, I don't think I did, but over time, when I got more into the routine of doing it, I was like, "Oh, wow, I'm getting, my activity in for the week." Because it would be like from the middle school, it's like a mile, and then from the high school, it'd be a half mile. So I definitely got a lot of walking in. I mean, if that wasn't enough, walking around campus every day, um, was a lot, and because the layout of both the schools, they're both very, big and open. So, um, yeah, I got a lot of walking in, and I also did a lot of stairs. Um, and stairs are a little bit terrifying for me, but I still did it anyway because that was the, more efficient way to get to class sometimes.
How did you
Um,
make sure you didn't overdo it?
I made sure to rest, like, immediately when I got home. Um, I would make sure to take breaks, or if there was a class that was, like, on one side of campus and I had to get to the other side, or, go farther out because it's in, like, a portable type thing, I would, make sure to use the extra time to get to classes. Um, so it really just kinda depended on the day. And also, if there was like band practice or something, I would make sure to get a ride for those types of things once I was finished. Um, and I think at one point during, I want to say it was high school, I was able to start like it was some point in like late high school that I started um, using a ride every once in a while, since that could um, help take some of the relief of having to walk home off of me. But um, otherwise, yeah, like it was a lot to balance with, but um, I made sure to get the rest I needed in there.
Did your mobility affect where you wanted to go for college?
No, I am very fortunate in that as well. When I started to look at colleges, I my approach really was like I had a particular program that I was looking for in colleges, and I didn't want to let the location um limit me for where I can go, and so I had my parents take me and tour colleges and look at the access office and all of those different, housing and all those different aspects. And, and it would be like, okay, I can walk around here and do this and that. So yeah, my mobility wasn't limiting where I could go for college, thankfully.
This is tricky because I didn't consider going away for college.
Mm,
I attended one in-person course with my mother for 3 years. In addition to all my regular supplies, we had to pack all my special equipment, and don't underestimate the hassle of inclement weather. I
yeah.
have been taking a combination of asynchronous and synchronous online classes since.
Mm.
These options allow me to access the curriculum more conveniently in the comfort of my home, while my mother does what she needs to, checking on me periodically.
Yeah, I definitely didn't have to worry about any of those kinds of factors, and that's definitely something to consider if, when having um extra devices to help you. And so yeah, I think the main thing was just making sure that I could, get to where I needed to go. Um, and that first year of me going away to college was definitely hard, because that was like the first time that I was physically away from home at like 4 hours away. Um, and but at the same time, I was like, okay, I'm on my own, and all the decisions that I do, affects and impacts me directly. So I had to be more cautious of what I was doing, like how often I was doing activity, those types of things. But I was able to make it work.
Did you do any physical activity and/or therapy while away at college?
I did. I think it was like my third year of college where I started to um want to include like workouts, but I was wanting workouts tailored to specific goals for that time. And my school offered personal training at the rec center. And so I um, went through that process and got matched with a trainer, and he was really awesome. And he saw, that I was disabled, but he's very familiar with not treating me any differently because of my disability. Um, so, he went through the assessment just like anyone else and was like, okay, we got some stuff to work on. And, um, and was able to tailor everything and modify things as we went. And he also specifically made sure to like if we were using machines to make um movements separate so that I wasn't like compensating with like my good side to help with the other one. So But yeah, he was really awesome, and he told me at one point that he has a family member that's also disabled, but he like works out and does
Mm.
all the things in the gym. So he had like that personal experience of living with someone with a disability. So and he was like, yeah, you totally have this. Like you're one of the most functional disabled people that I had that he had met. I had to get that worded right. But yeah, so he was awesome too, and like researching CP specifically and going to other people that he knew to help tailor the workouts for my goals.
What is the difference between the physical therapist and personal trainer?
Yeah, that's a very good question. Personal trainers and physical therapists, their main difference, at least from what I understand, is their level of education and what they are able to offer in terms of services. Um, Physical therapists, at least from what I've read, now um, go all the way to a doctorate and get a doctorate of physical therapy. So they put a lot of time and research and have a lot more clinical experience to address um, injuries and people with any kind of disability or ailment and help them get back to their normal level of function. Um, and they have more options on how to treat those different things, whether it's through exercise or acupuncture, um, manual therapy. So there's a wide range of those things. And then for a personal trainer, they can also have a lot of education and have a bachelor's degree in like health sciences and stuff like that. But usually, personal trainers, if they're going a personal trainer route, they will also have like a certification in specifically like fitness areas. So that could be um, specifically like specific sport, um, and they work mostly on fitness related things. And I like for me, I also told um my first trainer, Noah, that I had a disability, but he also was like, okay, well, just upfront, that I am not a physical therapist, but I can help you reach your fitness goals. So I definitely knew that going into it. But personal trainers definitely work more on the fitness side and try to improve um, movements and um, just more like physical fitness needs as opposed to like physical therapy having more of like a medical background with the movements. But like physical therapists have more of a expert in a lot of more well-rounded sense of how the body moves and how to treat that and help with diagnoses.
Did you come home between semesters?
Yeah, I was at home in between, and I I basically took that time to do some physical therapy, but um depending on the year, because there was a lot of the times when I came home from school for the summer, I would take a summer class because I was like, I just want to get stuff done. And and so I would, if I was in the middle of like a recovery or something, I would be like, okay, let's do some um physical therapy on the side, but it was definitely a lot to handle. And also, like, I did do physical therapy, like, while I was at college, like, I had to go through that process of finding a place near my school and, like, finding the way to get there and all that. And so a lot of, like, when I did a lot of walking at from when I was in middle school and high school, it definitely helped when I had to do a lot of walking at college. Um, so but the only time I did physical therapy while at college, I was already in the middle of a recovery from surgery. So I was like, okay, I need to prioritize um, some recovery in there. So I literally would like walk down the road to the nearest PT place and go to treatment. And I did that like 3 times a week, and I had to, go back and get ready for class. It was a whole busy day for me on those days, but um yeah, it was a lot of work.
As an adult, have you revisited any oral medication and or injections?
Oh yeah. A lot, a lot. Um so I do have some oral medications, but um I think the most important one is my anti-seizure medication. And I did try like a medication to help spasticity. I had never considered that before, just because I never really thought about treating that specific symptom. And so I tried this medication called baclofen, and it definitely helps a little bit. Um, but once I addressed specific um like pain issues that I was having, I realized what that spasticity was coming from, besides it being a CP related thing. Um, and then as far as injections go, I have done those, mainly for the back problems that um, I've like had to deal with the last few years. And those were like epidural type of injections, and those specifically went into like what are called facet joints, and they just kind of help your back be able to um bend like it should. Um and those like kind of helped, but they didn't last as long as they should have. And so my next step was to get this thing called an RFA, or radio frequency ablation, where they literally go in your back and burn um the nerves at those joints. And those have significantly helped more. So I've definitely had my fair share of like injections and trying um some medications. And it just kind of depends if they're gonna help or not. But I went through the steps. I went through all the steps to get to where, treatment was gonna work best for me.
I haven't pursued any of these. A lot of factors go into how tight we are, like hormones or stress. Like we probably mentioned, some people have a backbone pump in their stomach or get Botox and have to go under every so often for either of these.
Mm-hmm.
I have made so much progress naturally, even though I use a wheelchair. I used to need my parents' help to do homework every night, but as the material got more involved, it's easier for me to do it independently rather than explaining it to someone, except for math.
Mm-hmm.
Every time I see my neurologist, adding spasticity meds come up, but I'm always like, what's my normal? In 2016, my left leg brace kept breaking and I started getting blisters repeatedly.
Mm-hmm.
We went to the orthotist and a physiatrist referral was made. My high muscle tone was making them break. The podiatrist, of course, offered the CP treatments that I can't imagine doing. So the orthodontist made me a new brace with an extra smaller piece to put on before I put my left brace on.
Mhm. Yeah, there's a lot of factors to consider, and I'm certainly in agreement. Like a lot of the time I'm just like, I don't know what my normal is because like spasticity can
Yeah.
happen all the time. Like it happens all the time. And for me, like I for me it's a lot of tightness. And then specifically my back, like um I can actually like I can feel a physical um pain with it. So it really just kind of depends, and it like can vary with activity. And um a lot of the time too is like if we're sitting there in the doctor's office, like, and they're like, how's your pain level right now? And it's like a 0 because I'm not doing anything. And so for me it's interesting just how I've had to approach these situations, because I don't, my normal is, it just depends on the day. And that could just be the fact that it's a, chronic, um, kind of condition. So it
And it's
depends.
not
Yeah.
just spasticity.
Yeah, there's a lot of factors too, and especially with like major surgeries as well. And just kind of how well they hold over time, like it, can physically change over that period.
A lot of movement disorders.
Mm-hmm. Yeah, and I mean for my case with also like now being um having epilepsy, I my situation with that, it basically deemed it to be idiopathic epilepsy. So um a lot of that right now for me is still unknown, and I'm taking steps right now to kind of see if I can catch like what causes an episode or what my particular symptoms can look like, because I know sometimes um some of the common symptoms before a seizure will occur is like twitching or something, and for me that might be just like a spasm and not really anything. Um so it really there's a lot of factors to consider, and it's a lot to keep track of sometimes.
In February, I had to get iron transfusions, so it is always hard to determine what we are tired from.
Mhm. Yeah, yeah. I'm in the middle of a recovery right now, and so any little activity that I do can make it really like I'm exhausted by the end of the day. Over the last couple years, having to balance college and work and other extracurricular things, I really had to just pay attention more to how often I was doing things, because I would be so exhausted by the end of the day. Um, and so it was just like, oh, was it, going out and walking across campus that made me tired, or was it
Yeah.
classes that made me tired? all of those different things that you have to physically, be active doing. So yeah, it's hard to keep track of, and then when it comes to like the different um medical things that I've had to address as an adult, like it was hard to really pinpoint, what's causing the pain, um, the symptoms with it, those types of things. It's really, really hard. So it's a lot of trial and error with some of that. But when you finally figure it out, it's just lovely, like very satisfying.
Please discuss your surgeries during college.
Yeah, so basically I when I started working in general, I was on my feet more often. Um and so at one point I noticed that my feet were hurting quite a bit, like probably to the point where I started thinking like, okay, this is probably not normal. And so I went to a local um podiatrist in the area and was like, "Oh, you need to get surgery done. Like, um, any type of orthotic is not going to help with that because it was a type of foot deformity that was occurring. So instead of my feet, being like straight how they were starting to go out because all of the arch in my foot collapsed, and so basically I was walking around with like flat feet, and I think I also had bunions too. So it was, like walking on kind of like rocks almost. Um that's the best way I can kind of describe it. Um so I literally had to take a semester off of school to go address my first foot correction, and then I think that was like in 2020, so that was like a month before everything shut down. And then I had another foot correction, and I was able to be at home for that whole thing while taking classes. And I will say that I do not recommend that because that's really hard. It's really hard to balance both. Um, and um, and then what was it? So I was towards the end of my college career at the time, like when I got through that recovery, and I was like, okay. And I had like one more foot correction to do to kind of add things to the first one. So I waited until after I graduated. And so I graduated from college in May of 2022, and I waited until after that to get the last foot correction. But yeah, it's balancing those two was really hard, and that's kind of where the PT came in at one point because I was like, okay, I need to, work on getting physically better so I can um improve my mobility since there was a lot of walking to do. And yeah, it was hard. Um it's definitely doable, but it's part of me, it's like not totally worth to put the pressure on yourself to balance both of those things, especially when fatigue can happen so quickly while you're recovering. But as long as I had good support during my time, so having that good support and assistance during those periods that I was recovering, um, helped get through those periods a lot, and so it was hard.
How many surgeries have you had as an adult?
4. I've had 4. Um, my most recent surgery was actually back in February of this year, to fix my right SI joint, which is like this joint that's connects your pelvis and your spine together. And mine was like basically it moved too much, and um it was really worn down because of how I walked before that surgery. And so there was just a lot of body compensation, and that joint was just in not the greatest shape. um And yeah, I had to get that fixed because it really got to the point where it was just really debilitating. Um, and it affected when I got up in the morning. Any activity that I did, if I were to lay down later, I would wake up and be like in so much pain. I would be like hobbling. Um, and I didn't know what it was because it presents itself feeling like a back issue, um, or a hip issue. And there's a lot of ways to kind of figure out what, if the SI joint being the main causes of the pain. And that was through a diagnostic injection where basically they put steroids in there. And they also like literally poke the joint and see how your body reacts to it. And for my case, in particular, my joint was so bad that when they poked the joint, I like almost like fell off the OR table. Um, so hearing about that afterwards was interesting. And they had to repeat that twice just to make sure that's exactly what it was. And I had the same exact reaction. So like I would have relief for a few days and then basically it wore off. And so the doctor was just like, let's just fix it. And we put 2 screws in there
Mm.
and now it's better.
What would you tell other people about fitness, especially when we associate it with physical therapy?
So I think for fitness is like basically kind of going back to the physical therapy versus the like personal training kind of goes back to that a little bit because if you're approaching your fitness journey on your own, um you're going to be focusing a lot more on the exercises and the movements. And I think those two things, especially in recovery, it really kind of helps build off of what you're doing in physical therapy because you're going to have to do a lot of functional movements in life in general. Um, so having to do those two things is really important, and um, make sure to be consistent with it. And I think it's okay to acknowledge when you have to go back to physical therapy, um, or at least reach out to your physical therapist, when you have trouble with something. Um, it's it's a whole experience for each individual. So and find something that's fun to do. That's I like for me as an adult, I got more into CrossFit and I learned the benefits of CrossFit and doing it's a lot of strength training and um incorporating a lot of functional movements, and I have fun doing that. So um and there's a lot of different activities out there. It's just you have to actively search and um try out those activities and find the place that best fits what you're looking for.
I think functional is easier.
Yeah, it can be, and especially like once you're at your like base level of function, it's like, okay, these are easy. So then you can like start building up the strength with it and just having fun, doing different kinds of workouts and just kind of seeing what your limits are, in a very safe manner. Um, and yeah, it's those are yeah, functional is definitely easy, but building up the strength for that sometimes can be hard, depending on what you're working on.
Thank you, Isabella, for doing this with me.
Yes, of
We
course.
have you on.
Yeah.
Please share this talk show with your family, friends, and colleagues. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.